Millions of Americans have defied recommendations by public health officials not to travel over the Thanksgiving holiday, as fears rise that it will be a major super spreader event. The US has recorded more than 180,000 new COVID-19 infections in the last 24 hours alone, the highest in the world. Experts have warned the holiday season, including the upcoming Christmas, Hanukkah and New Year celebrations, will expose more elderly and high-risk people to the virus and cause a spike in cases and deaths. Meanwhile, turkey farmers have bred smaller birds this year to accommodate smaller gatherings, and as Miranda Lin reports, demand is higher than ever.
Thanksgiving in the US, a time to reunite with family and friends and sit down together for a feast. At least it was before the pandemic. But with daily infections still over 100,000, public health officials have pleaded with people to limit their travel and gathering sizes this year. Previous holidays, like Labor Day and Halloween, have all been followed by spikes in the virus.
It's really disappointing, and it happened at Easter, and now it's Thanksgiving, and it'll be Christmas, I'm sure. So what can you do? Gotta be safe.
Many businesses that rely on Thanksgiving and Black Friday the day after are bracing for the impact of this year's restrained celebration. PricewaterhouseCoopers has estimated sales could drop by 20% compared to last year. But ingredients for the centerpiece of the holiday, the turkey dinner, seem to be more in demand than ever. Around 40 million turkeys are eaten around Thanksgiving annually, according to the National Turkey Federation. Thanksgiving is responsible for about 65% of the overall business at Jane Doe Farms. The family-run company in Pennsylvania sends more than 400,000 turkeys to customers around the country. They say they've seen a 10% increase this year, thanks to their decision to offer smaller birds that suit the smaller dinner tables.
We're in the middle of the pandemic. We're anticipating that the smaller birds might be more advantageous. And how it turned out is we did sell more smaller birds, but we sold the same amount of larger turkeys also. So it was, we had the availability, which was good.
Jane Doe Farms has also opened a retail store to sell more turkeys year-round. They're thankful that their small business has not only been able to survive the pandemic, but is finding new ways to grow. Miranda Lin, TRT World.
Well, let's get more on this now with Dr. Scott Ratzan in Princeton, New Jersey. He's the co-leader of Business Partners to Convince, which is a global communication and education initiative to promote COVID-19 vaccine acceptance among private sector employers and employees. Welcome to the program, Doctor. Now, as we heard there, millions of Americans have defied warnings and travelled all across the country for Thanksgiving. The country's top infectious disease expert, Dr. Anthony Fauci, warned that the travel raises the possibility of a, quote, surge superimposed on a surge. How worried are you that Thanksgiving may turn out to be a super spreader event?
Well, thank you very much for the opportunity to be here today on Money Talks. It's really important that we all realize that we have to be vigilant at all levels of society. And a special day of Thanksgiving, whilst we have the biggest travel day normally throughout the United States and many people coming from other parts of the world for the special holiday, we have a whole problem to make a super spreader. So what the CDC and what you've been showing on the screen here have been saying here in the United States, these are trustworthy institutions that do follow the ideas of Dr. Fauci and the science and evidence that you've mentioned. They are really suggesting that people limit their travel and limit the level of interaction with people. And let me say the good thing is about 80% of Americans are likely to do that. Some surveys have it a little bit lower, but most people are going to be just with their immediate family. So there's some good sign that this won't be the super spreader that we all fear. However, that still leaves 20% of the population that will be likely to interact with so many people that we will likely see a spike in cases.
Of course, Thanksgiving is just one holiday. We've got a Christmas, Hanukkah and New Year's Eve celebrations coming up over the next month or so. These things are obviously celebrated globally. Are you worried that perhaps there might be a global super spreader event in the coming month?
Well, by no means are we out of the woods yet. Public health officials around the world need to be vigilant, and they need to be able to communicate with both business leaders, need to be able to communicate with celebrities throughout schools and so forth, that we need to limit our distance, physical distancing. We need to limit the amount of people that we're with, and we need to wear a mask. We're waiting for a vaccine. The vaccine will not be here for the whole holiday season, and we need to be concerned. At Business Partners for Convince, we're trying to get businesses to prepare, but even so, we know that people get their information from all sources, and we need to make sure that it's trustworthy and of the same scientific value that it would be for making good policy decisions.
Yes, and there has been a lot of excitement recently about the positive results coming from various vaccine trials that will hopefully be rolled out sometime in the near future. But there are some people who are also concerned about the prospect of getting an injection, particularly one that's been developed in a relatively short amount of time. And these concerns aren't just coming from so-called anti-vaxxers. I mean, these are people who do support the idea of getting immunised, but just are a bit wary about the speed at which these vaccines have been developed. Do you share those concerns? Should people be worried?
Oh, absolutely. That we share the concerns, but yet we know that we can overcome the concerns with the appropriate science, evidence, and regulatory decisions that we have both in the United States, throughout Europe, throughout the world. The World Health Organization needs to also have the strength and level that they have with international health regulations and be able to help us all know that this vaccine is safe. Having said that, we did a study over the summer with 19 countries of how many people would be willing to take the vaccine. And anywhere from 50 to 70%, depending on the country, would be willing to take a vaccine if it were safe and effective. We're studying that in New York, we're studying this globally, but it is a trend and a phenomenon that the World Health Organization called vaccine hesitancy. If this happens, that people do not take the vaccine, we will be in the same position that we're in right now for COVID for some time to come. It is incumbent upon all of us to try to work together to understand how the vaccine has been developed, to understand that it also has the level of safety and efficacy that we'd be willing to put it in ourselves, our family, our friends, people we work with, and that we also will be willing in the meantime to take the appropriate precautions to stem the spread. I'm confident that we can do that, but it's not going to be easy. We need to put business plans in place like we do for quarterly objectives, annual reports. I'm arguing that we should every business should begin to work on a plan for a Q3. 80% of their employees should be vaccinated. And hopefully by the end of 2021, all of them could be if we have, or when we have the safe and effective vaccine distributed and available throughout the world.
Okay, now in terms of a timescale, there are various predictions as to when any successful vaccine might be rolled out. Some people are opining that perhaps we'll see one in December. Others are saying well into 2021. What's your view? When do you think we'll see the rollout of any successful vaccine?
Well, the expectation is that the Food and Drug Administration in the United States will approve it for emergency use on December 10th. A couple days thereafter, it will be distributed. The ones that they may approve might need -80 centigrade travel or boxes. So there's going to be lots of issues in terms of the distribution. I don't think we'll have the penetration that's necessary to create the community immunity that we'll need until midway through 2021. So being first does not protect you. It might protect you, but it doesn't protect all of society. So we need to get to that 70% protection. But in the meantime, we still need to wear a mask and we still need to have the public health provisions in place. And that's why people here in the United States for Thanksgiving, like I said, most of them are alerted to the warnings from the CDC and are following. And we need to make sure that similarly, when the recommendations come out on vaccines, that we all also are able to get the vaccine in people. A vaccine is not any value if it's not being taken for protection for society.
Okay, Dr. Scott Ratzan, we'll have to leave it there, but thank you so much again for joining us on Money Talks.